Hi everyone and welcome to VDoc's first LinkedIn Live session. These sessions will be focused on the trends that will shape the future of clinical trials. My name is Alsén and I'm the business developer in Europe, Middle East and Africa, and I will be your moderator for today's session. During today's topic, please ask any questions because after the discussion we will have a live Q&A. But before going in, I want to introduce our speakers. First, Marialuisa Baldi.
Hello.
Marialuisa holds a master's degree in toxicology from Karolinska Institutet in Stockholm. She started off in the regulatory area of plant protection products and then moved into clinical research. Today, she's the Quality Assurance Officer at VDoc. Welcome. Joining Marialuisa, we have Yeomans.
Hi.
He has over 40 years of experience in computerized systems. He started off in clinical research already in 2000, and today he's a regulatory affairs manager at VDoc. On top of that, he's also the co-chair of Essential Metadata team at the Clinical Forum, also past chair of the regulatory expert group, and a member of the AI team, all at the Clinical Forum. So to go into today's topic, I will hand over to Marialuisa that will give us an introduction and the overview of the ICH E6 R3 updates and its significance for the industry.
Yeah, so you're right, Alan. So we recently have the new ICH GCP published, mainly the principle and the Annex 1. I will say that in general, the main scope of this reshaping of this guidance was basically to clarify some very important concepts that all of us that work in this field are already familiar with. The scope was mainly to allow us to have a facilitation when it comes to design a clinical trial and conduct a clinical trial. Some important concepts, such as participant safety and security, have been also very well underlined. But let me also say that another very important concept is the remark to ensure a very good and high quality of our clinical trial data. Well, when you go through the reading of this new document, of course, we can immediately see some very important remarks. The first remarks I will say is that we have finally a very detailed and explained division of responsibilities between the different parties, which is the sponsor, investigators, and possible third parties. And this is, in my opinion, it's very important because, of course, this allows a very good workflow and a very good communication since day zero when you start your clinical trial. Another important point is, of course, that the risk assessment that we have to place during the whole clinical trial process. And this is, again, very important because, A, ensure good workflow, as already been mentioned, but mostly a good oversight. And having a good oversight based on the risk is also another key important concept, because this will allow all of us to have a good control and possibly avoid any kind of problem in our clinical trial. But one, I would say, of the most important, of course, in our field is the introduction of a new chapter, which is data governance, investigator, and sponsor. This chapter basically recognizes the pivotal roles of computerized systems that are used in clinical trial. Besides, again, the well done and written division of responsibility between the sponsor and investigator, we have also important concepts such as security, privacy, and validation. And these are the three key concepts to take into mind in order to ensure a good data quality, meaning taking care of the data during the whole life cycle in a clinical trial, meaning from the data capture to the data destruction. But let me add something more regarding this chapter. It has the roots from the EMA guidelines on computerized system. And I really, really liked it because this is strong efforts from our regulators in order to make everything like connected between the different regulations that we have outside. So this is very good for us in general, I would say. Yeah.
Great. Thank you so much, Marialuisa, for that overview and insight. And also you touch upon oversight. And often when I speak to clients today, I typically hear sponsor oversight and feel that is a new buzzword in our industry. And over to you, Alan. How do you see effective oversight looks in practice? And also how does the role of tech providers and CRO fit into that picture?
Yes, certainly. Yes, the new ICH, as Marialuisa mentioned, it goes into a bit more detail about the responsibilities of the sponsor, the investigator, and the ethics committee, those being the three main parties that they talk about. And they do mention oversight. So the sponsor has their own responsibilities, but they're also responsible for overseeing the study and making sure that the other members of that trial, that they are performing their duties and that they're following the path that's been laid out for them in the study. When it comes to vendors can be a vendor to the sponsor or to the investigator site, but it's still the sponsor's responsibility to ensure that the vendors basically follow the same rules. So they're trying to ensure that your sponsor or that your vendors will do what they're supposed to do in the study. So if you've got a CRO performing some of the sponsor duties, it's still up to the sponsor to ensure that the CRO is performing those duties. If they've delegated some of the data collection to a vendor such as VDoc, then it's the sponsor has to see the oversight of VDoc as well and make sure that the data is being collected properly. So that's really what they talk about when they mean oversight. And they want to be able to see proof that the sponsor is performing this oversight. So it's not just enough to say, well, yes, we got a CRO to do it, so they're doing it for us. They want to be able to see that the sponsor is actually doing something and checking.
Great. Thank you, Alan, for that comprehensive overview and an insight of the different roles and so. And let's go a little bit more into an inspection, for example. So let's say that sponsor get notified of an inspection already tomorrow. Over to you, Marialuisa. How well do you think sponsors are prepared for demonstrate their oversight module, how it works, and that they have that in place, and just beyond the SOPs that they maybe have written?
So I am quite confident that the sponsors are ready because when you design a clinical trial, before you start a clinical trial, there is a lot of work on behind. So you have to establish again the procedures. And these procedures are based, of course, on the risk based and on the scope of your study. So you need to have certain standards in order to select the proper sites, the proper investigators. So there's like lots going on behind it. So this means that when we start a clinical trial, everything on the back is ready. So this means, and then of course, we have our regulation outside that we have to be compliant with. So I don't think that any sponsor goes blind and starts a clinical trial without knowing or without anything settled in terms of oversight. Again, this word oversight is very important. So I think that if a regulator comes and knock to their door and say, hey, I'm going to inspect you tomorrow, I think there is no problem. And ironically, I will say they should also be happy because I think that regulators are there outside to help us, and we need to change our mindset. We have to think about that we are playing on the same side of the field. So meaning that all of us wants to make the world healthier. All of us wants to basically rise the life expectation and makes life better for everyone in the world. And this is very important. So if a regulator comes, what you have to show, again, as Alan mentioned, is the evidence of what you're doing. It's another concept that was basically mentioned in the guidance is the transparency. And transparency is very important. And how do we establish the transparency? Through a continuous communication between the involved parties, including the regulators. So, and at the end of the inspection, if we have some findings, again, we should be happy because the regulators want to have high quality clinical trial, so meaning high quality data. So this, of course, will ensure a successful clinical trial. So that's my thought. Maybe too much positive, I don't know.
But I think you should see an inspection as the chance to be better at what we're doing.
Yes, yes.
If we're inspected, we're getting positive feedback from the inspectors, and they're saying, well, you should be doing this instead of that. You should be better at this. That's the way we should see it, how we get better at our own jobs.
Indeed. And we have to be confident of our work, of the workflow of our clinical trial. We know the bones of the clinical trial and the process behind. So we need to be confident and happy about it. And if something, again, it's not really good, there is always the chance to improve it. As long as we put resource on it, I think we are in a good side. The sponsor is in very good shape.
Mm-hmm. Thank you so much for the insights, and also that you swifted to a positive state of mind. I think maybe it is a human thing to, when you get inspected somehow in the regular areas, that you are getting looked into, you maybe see this as a negative thing, but instead of use that as an opportunity to perhaps accelerate, become better, and also leading the path to maybe succeed in a trial. So really great mind shift there. And over a little bit more on technology. Also, Alan, what do you think about what specific expectations does this guideline put on vendors like VDoc? And VDoc could be one part of the technology stack, but how could the sponsor ensure that that you have compliance across the tech stack?
Yeah, I think one of the important things to remember is that these requirements that are placed on the sponsor for transparency and how they're supposed to respond in a clinical trial, these are also delegated down onto their suppliers, on their vendors. So on us as a technology vendor, for example, there's the requirement that a sponsor must always be open to audit or to inspection. And that comes down onto us as well. We must also be open for audits by our customers or inspection by the authorities if they wish to come and look at us. We can't just turn around and say, oh, no, we don't want to do that. We think that takes too much of our time. We've got other more important things to do. So we've always seen that in the same way as we were talking earlier. An audit of VDoc, that's a way for us to get better at what we're doing. So we always welcome auditors who come to us and who want to talk to us. Think how much you'd have to pay if you're going to get sort of organization consultants to come in and tell you how to be better. It would be extremely expensive. Now we get people coming and doing it for free. So that's really good. So it's, free consultants. That's the way we see it. It's a way to get better at what we're doing. And so among our responsibilities, though, is we have to help our customers, help the sponsors, help the CROs to be able to understand what's going on in their studies. We have to give them the technical features and functions that will enable them to do their job, to do their work. So that they're not just sitting there with a pen and a paper trying to understand what this advanced computer is doing. We have to give them the necessary reports, the necessary exports, enable them to do their work and to have their oversight. Some cases, oversight is a lot simpler if you can get a simple report out of the system telling you how many users you have or when they were last logged in. And it's a lot easier then to do your job and to prove that you know what's going on in your study. So I think that's very important to us. And also to be very transparent when it comes to our suppliers. We have a number of suppliers that are GCP significant, and we treat them the same as our customers treat us. We audit those suppliers. We make sure that they have procedures. We look at their QMS systems. This is very important that we have the same requirements on them as our sponsors have on us and as the inspectors, the authorities in their turn, have on the sponsors. So it has to be rippled down all the way through the chain. So this is very important.
Great. And accessibility was one point that you highlighted, Alan. And we just assume, like in this case now, we get an inspection tomorrow. There is so many technology are used from a sponsor in a trial. Being in an audit within 24 hours could definitely be challenging amongst the amount of vendors that you may be controlling a trial, which brings us to the next point about our VIRP for clients. That is our VDoc inspection readiness package documentation that is accessible for all clients that proves VDoc. And you have been in the industry and at VDoc so long, and were a part of the development and implementation of that solution. Please, Ella, could you elaborate a little bit more on?
Yes, certainly. This is our way to help our customers get ready for an inspection. The authorities, they expect you to understand the systems you're using, even if you're not actually developing the systems yourself. Even in some cases, may even be a CRO that has the contract with VDoc and not the sponsor themselves, but they still expect the sponsor to understand what is VDoc, how does it work, what does it mean to the study. So what we do is we produce the VDoc inspection readiness packet, where we provide all of our customers with this basic information. So it contains the full user requirement specification, the traceability matrix overall testing. It has a validation summary report, which describes all the testing that's been performed for the latest release. We have the release notes, the release certificate, an impact assessment, which will show you which parts of VDoc have been impacted in this new release. So if we've only made a release for the coder and you're not using the coder, then you know your study's not going to be affected at all. Whereas if you do use the coder, then you think, well, maybe I'd better read the release notes and see what's changed. So all of this is information we provide with every new release. We have an EDC management sheet. We have a cloud computing checklist. So there's a lot of information there to help you keep up. Now, our main goal with every release of VDoc is that nothing will change. So new functionality is disabled by default for all ongoing trials. If you want it, you have to turn it on. If you don't want it, then it shouldn't just turn up in the middle of your study. So everything has to be backwards compatible, so we don't all of a sudden change a function, so it works in a different way and stops working the way it did before. So you should be able to read through the release notes and see what's been added, and very quickly come to the conclusion that for almost all studies with almost every release, it's not going to affect you at all. So you can just sign off on a one-page sheet saying, yes, we've investigated what's going on. No, we're not affected. And you can put that in the TMF, and you can show that to the authorities when they come around, and you can say, we have oversight of our vendors. We know what's going on with VDoc. We know what's happened with every release. We've evaluated it. Here's the proof. So this is all meant to make the sponsor's job easier. We're more or less setting the table, so inviting you just to sit down and sign the bit of paper once you've read a couple of documents. And
can definitely understand that would be a great beneficial for a sponsor. And you mentioned, I mean, if you're the direct contractor, you have the accessibility. But anyone that are using VDoc have the opportunity to either reach them or reach the QA department at VDoc.
Of course, and how much detail we put into the VDoc inspection readiness packet. Of course, there's always more detailed questions that could come from the inspectors. You can, I mean, even if we put the full source code in there, you couldn't read it, you wouldn't understand it. So what we do say is, for anyone who's having an inspection, any of our customers or their customers who are being inspected, just reach out to us, let us know. We can be available on the day. If there's a question that comes up that you don't have the direct answer to it, you can let us know and you'll have it straight away from us.
Yeah, we reserve basically in our calendar, in the team calendar. And the moment the question comes in, we immediately provide the answer. We also have the case where we had to jump in meetings with the regulators as well. So so please write us at audit@vdoc.com in case you have an inspection, as also Alan said. And we're happy to help.
Yeah, great. And a great opportunity to get better. I mean, going back to the thing of getting inspection tomorrow. So great insight, and also.
But maybe I can also take this chance to say, of all the inspections we've had over the years, there's never been an inspection finding on VDoc as such. So let us help you, and we can ensure that your inspections go smoothly.
Great, perfect. Thank you so much, and I hope that the insight of today's topic really gave some value for the audience, and that was what we had prepared to go over. And I would now like to move on to our live Q&A. And again, I encourage everyone in the audience to ask any type of questions that you are curious about. And if there is too many questions and we don't have the chance to answer all of them right now, we will publish the answers on our social media platform. So let's see if we have some question available here. So, could you elaborate on the concept of quality by design as presented in E6R3?
Yeah, so like quality by design, yes. So again, like you need to basically design your trial, ensuring like the good oversights and controls, and to ensure like a very good data quality. But when I say data quality, I also mean traceability of the data. So a word that everyone knows, I think, at the audience is, for example, audit trail. You need to ensure that all the systems that you're using have an effective audit trail, because everything should be traceable since stage 0 of the clinical trial. Quality of the clinical trial is also like a good workflow and communication and trust. You select the sites, the investigator, because you trust them. So give them the space and the trust to do their job. And please also establish a well SOP and procedures based again on the risk assessment. If you say higher risk, please place in high oversights. You have the monitors that can do this for you. So please do that as well. So just a few points and tips. Alan, you want to add something?
No, except for the, I thought, gets rather obvious point that quality is not really something you can add on afterwards.
No.
And that's what they mean by quality by design. You have to think about it right from the start. It has to be a part of the whole process. And then you can't just come along a week before the inspection and say, oh, we better have some quality in here.
No, and whatever you see, maybe some glimpse of it. So then you should basically place a good control and solve the problem, of course.
Great, thank you. Thank you so much. And let's see, I don't think that there is any more questions here, and perhaps the audience is a little bit shy. But if questions comes up, you're always welcome to either ask the QA department directly at audit@vdoc.com, or you're always available for reach out to me, ask questions directly. But other than that, I really would like to thank both of you for sharing your knowledge and the insight. Just as a side note, I often get complimentary of our QA department. You said it before that you are quick in the responses,
Yes.
and I mean you are there for our clients. I just wanted to really highlight that.
Thank you.
Thank you so much for everyone attending. And stay tuned for our next LinkedIn live session. And I wish all of you a great day and a good evening.
Thank you.
Hello, bye.